All right, we got a quick little video here for you about documentation, just kind of a basic overview of a couple different formats and a couple different things not to forget to put in there. Get right into it here. There's pretty much two basic, widely accepted formats for your PCR. I know the book goes into several different formats, but the most widely accepted are going to be your SOAP format and your chart format. And so with SOAP, it's subjective, objective, assessment, and then your plan for treatment. You will want to go through and look at that, and then also go through your chart format, which stands for chief complaint, history, assessment. The R is actually your treatment, RX, and then transport, and then at the bottom exceptions if you choose to use the E on the end of that. Whichever format you choose, practice it, become comfortable with it. Those are the two that are, like I said, are the most commonly accepted. Try to stay away from your storybook and your chronological and stuff like that, because most, I'll go ahead and say most EMS services prefer you to stick with either the SOAP or the chart. It just makes it easier. That's what billing is used to, or whatever. And I personally, I use chart, but I don't have anything against SOAP. That's just what I learned on was the chart format, so that's what I use. So either way, they're both good. Just whatever you want to learn, be comfortable with it, and then stick with it. Something else I want to touch on is whenever you're doing these narratives and stuff, be very concise and accurate with those, and don't leave stuff out because of, say, and it happens unfortunately whenever you're working, if it's you and an EMT, a paramedic and EMT partner or something like that, and say the paramedic doesn't want to do the report on it, so like, hey, just leave out the patient said he had sharp chest pain. Oh, it doesn't matter, just leave that out. Or leave out the fact that he was bleeding profusely out of his left arm. It'll be okay. Don't stand up for your partner and allow that to happen. Go ahead and make a stand and say, nope, if this patient said this, I'm going to put it in. And of course, don't try to throw your partner under the bus, but make sure that you are putting in everything that the patient told you. Be very accurate with those. I mean, it is a legal document. You don't want that. It's not worth you losing your license because of someone else pressuring you to omit a detail for some reason. Maybe they're just lazy or late at night or whatever like that. Also, whenever you're doing your reports, be sure to put in there, and I don't have any other slide for it, but be sure to put in pertinent negatives on those patients. Patient denied having chest pain. Patient denied having shortness of breath. Those are really good liability type things, because if you never mention shortness of breath in your report, it could possibly come back that, well, he said he was short of breath. Well, nothing in your documentation says either way. So it's very good to just kind of CYA type thing of patient denied neck and back pain upon palpation. It's saying that you did assess that, and at that time they denied it, and it just covers you in case anything happens. So that's just kind of a quick and dirty. The main thing is on the SOAP and the chart, find which one you like of those two, and then stick with it, practice it, get good at it. All right.